to the fight over reopening. Let's take you first to Florida. It's a state where Governor Ron DeSantis is now being applauded as a hero for pushing back and pushing back down an outbreak and reopening Florida. Florida is notably vulnerable because of its significant senior citizen population, 350,000 residents and staff at nursing homes across the state. This after the media, remember this, the media tried to condemn Florida Governor Ron DeSantis as a public menace for his moves. Turns out they were wrong. Watch the governor call out the media for dishonest reporting on Florida's COVID-19 response.
Data is available. Our data is transparent. In fact, Dr. Birx has talked multiple times about how Florida has the absolute best data. So any insinuation otherwise is just typical partisan narrative trying to be spun. And part of the reason is that because you got a lot of people in your profession who waxed poetically for weeks and weeks about how Florida was going to be just like New York. Wait 2 weeks, Florida's going to be next. Just like Italy, wait 2 weeks. Well, hell, we're 8 weeks away from that, and it hasn't happened. Not only do we have a lower death rate, well, we have way lower deaths generally, we have a lower death rate than the Acela Corridor, D.C., everyone up there. We have a lower death rate than the Midwest, Illinois, Michigan, Indiana, Ohio. We've succeeded, and I think that people just don't want to recognize it because it challenges their narrative, it challenges their assumption, so they got to try to find a boogeyman. Maybe it's that there are black helicopters circling the Department of Health. If you believe that, I got a bridge in Brooklyn I'd like to sell you.
Charles, he's really angry. You know, how did the media get it so wrong here, vilifying and attacking him at the outset?
I think the reason that they got it so wrong is because, yet again, you have so many people in the media who are driven by partisanship rather than common sense and sort of having an open mind about things. I mean, it's not complicated. The difference between the way Ron DeSantis handled the situation and Andrew Cuomo handled the situation. In New York, Governor Cuomo prohibited nursing homes from saying no, turning away patients who were infected with the virus from coming into the nursing homes. Well, any common sense analysis would have told you that's a very, very bad idea when you're talking about a virus that targets elderly people. And it was a host of decisions like that, just simple, common sense decisions that Ron DeSantis made in Florida, that Andrew Cuomo in New York did not make, largely, I would argue, driven by a political bias. And of course, the media, because they're so infected by the political bias, completely ran off, and they're still heaping hosannas on Governor Cuomo today.
Yeah, but you know what? Florida has 1.2 million more senior citizens than New York. New York has more than double the fatalities from nursing home, including residents and staff, than Florida. Florida has 2,100, New York has 5,500. You know what he did? You know what Ron DeSantis did? He studied what happened in 1918, in 1957, 1968, yep. And he said they didn't do national shutdowns. We're going to be smart. We're going to do targeted risk mitigation, like social distancing masks. And also he said, shut down the nursing homes. Don't allow COVID-19 back in. He saw what happened in South Korea and Italy, and he saw that 80%, massive amounts of the fatalities were elderly. And that's true now. CDC is saying 80% of U.S. fatalities are from nursing homes. He also zoomed in lots of PPE into nursing homes, and he, had the National Guard testing in there. New York State didn't do that. Pennsylvania is also following the New York model, so is New Jersey.
Right. But by not letting the virus get into the nursing homes in the first place, it turns out that was a very smart, but again, a commonsensical step. And obviously, for Governor DeSantis, that elderly population is a population that Florida is very, very concerned about because, as you point out, they have a higher number of elderly people there than other places in the country. But I think another reason that they have been so much more successful is that because because they are used to annual hurricane seasons, they understand the importance of preparedness, and they understand the importance of proper emergency response when you have something like this. And again, it cannot be infected by politics. If you let politics override the common sense, scientific, historical knowledge about how to handle this kind of thing, you're going to wind up with a disaster on your hands. And that's why Ron DeSantis didn't have a disaster, and Andrew Cuomo does.
You know, Governor Cuomo is now trying to downplay calls by Republican New York Representative Elise Stefanik. She's saying we need a federal probe of what happened in New York. Andrew Cuomo is saying, well, it was CDC guidelines for my call to put, recovering COVID-19 patients back into nursing homes. But those are CDC guidelines. They're not the law. They're not the rule of the land. And, basically, Florida's governor didn't follow the CDC guidelines. He did common sense. He said, don't do it. Protect the nursing homes from COVID-19 patients. Why is Pennsylvania not doing that? How come New Jersey and New York didn't do it? Do you really think it's all politics there?
I do think it is all politics, but of course it's the lamest excuse there is to blame it on the CDC. Governor Cuomo, you got elected. New Yorkers elected you, and I've always believed that voters will forgive leaders for making mistakes, even in a crisis like this, especially in a crisis like this, an unprecedented crisis like this. But if they detect that those leaders are playing political games, and I have a hard time seeing how a lot of this is anything other than political games, voters will punish politicians severely for playing those sorts of political games at a time like this.
And by the way, New York's numbers might be lowballed because they don't include nursing home residents who passed away in hospitals. So the fatalities from nursing homes could be higher. And here's the thing. Here's what's happening. Nearly half of U.S. households have lost income since mid-March. Tens of millions out of work. Thousands on food lines, standing on food lines with their children. Small businesses destroyed. Voters even in California, Illinois, Pennsylvania, Michigan, Charles, are pushing back on lockdowns. New Yorkers are now talking about this column in the New York Post that says, quote, there is no longer any reasonable justification for the government to deprive us of our livelihoods, and our rights are not the government's to grant or take away. They belong to us, the free grant of nature and the God of nature. We're Americans, more than that, New Yorkers, goddammit. And you could hear that clarion call from many citizens across the country.
Absolutely. Absolutely. And the thing here is that, in Washington, politicians are spending all of their efforts right now trying to figure out how to spend another $3 trillion. You will never spend, the government will never spend our way out of this crisis. The only way out of this crisis is for people to get back to work, get back into a position to take care of themselves and their families. And that's not going to happen until these lockdown orders are lifted, until people can go back to work, until businesses can open back up. And that ranges everything from restaurants and bars to auto factories. We need to open back up now. Obviously there will always be risks associated.
Poverty kills too.
Yes.
Yeah. Poverty kills
Absolutely.
too.
And isolation
and you're saying
kills.
There are comments.
And
isolate. Yeah.
Yeah, and isolation and frustration and not being able to take care of your family, all of those things kill too. And also, it's a violation of our rights. It's about freedom. One of the things about this country was founded on the idea that freedom is not your safety is not guaranteed. There are risks, but Americans are comfortable with risk.
Yeah, and it's about common sense to protect yourself so you don't get infected and basically have you or your loved ones pass away. It's about common sense. Charles Hurd, come back soon. You're a great writer and columnist. We love reading your columns and your stuff.
Thank you so much.
It's great to have you on, Charles.